I'm Dr Kris McQuaid, an Occupational and Environmental Medicine Registrar at Phoenix Occupational Medicine. This is just a quick video to discuss the outcomes of some research that has recently come out of Finland regarding return to work outcomes for workers who have undergone total knee and total hip replacements using a coordinated return to work care model. The paper is titled Return to Work Following Hip or Knee Arthroplasty, a one-year prospective cohort study in participants with direct referral from hospital to Occupational Health Care Services. It's authored by Kangas et al. And published in the Journal of Occupational Rehabilitation. A link to the article will be in the comments below. So, why should we be interested in the impact of major joint surgery on working age people? Aren't joint replacements more of a post-retirement issue? Well, for a combination of reasons, we're seeing an increasing number of people still in the workforce opting to undergo major operations like knee and hip replacements. We know from the Australian Bureau of Statistics data that osteoarthritis is becoming more common in Australian working age people, and major surgery for osteoarthritis is becoming more common in younger groups. I'll put the numbers in the comments section for those interested. What's new about this paper? We know a lot about how to get the best surgical and functional outcomes after joint replacements, including looking at returning to high impact sports. We already know that good work is good for your health, and we also know that time away from work leads to more time away from work. Kangas et al. Identified a gap in what we know regarding returning to the workplace after joint replacements and have recently published the findings of their research. What did they do? The Finnish research group developed a coordinated return to work model of care for patients that involved direct referrals from the orthopaedic clinic to an occupational health specialist. They then compared outcomes to that of a similar cohort receiving standard care. A key finding was that using the coordinated return to work model reduced time to return to work after both total hip and total knee replacements without increasing the risk of post-operative complications. Additionally, they identified key predictors for delays in return to work, which can help when it comes to planning a return to work. Finland and Australia are very different environments. What can we apply from this study here in Australia? Given the difference in culture and healthcare systems, the results are not necessarily generalisable to Australia. But there are some key points from this study that can be applied to the Australian workforce and healthcare systems, including occupational doctors can improve overall return to work and surgical outcomes by providing expectation management for the patient or the worker, details for proper risk assessment for the employer, refined predictions on the recovery and return to work timeframe that can be used for workforce planning. Measurable outcomes would include reduced but safe time to return to modified and full duties, increased satisfaction regarding the return to work process for workers and employers. So after all of that, my key recommendations from this study is if you are an employer, surgeon or worker involved in a large joint replacement and planning a return to work, involve an occupational health specialist early and communicate openly. If you want to know more about this topic or similar, including how and why occupational health specialists can improve return to work outcomes through early intervention, please sign up to our Early Intervention Done Right Symposium and follow us on your preferred platforms. You can find the link to the article in the comments section. Feel free to forward on any questions or comments.